Hi, my name's Acacia. I'm going to be administering the meds to our patient Edith Jacobson. Before administering any of the meds, I would make sure to be in proper uniform with my name tag, hair pulled back, and I would also make sure to have the proper PPE depending on what the patient's precautions are. But since he doesn't have any, or she doesn't have any precautions, I'd make sure to just wear clean gloves and perform hand hygiene. So first things first, I would go ahead and knock on the door. Actually, before I even do that, I would want to make sure to clear up some things about my meds, and I would first call the doctor. So I'd want to make sure to, and I would do this at my at like a med station, but I'm just going to pretend this is my med station / hospital. So first things first, I would go ahead and call the doctor. So I'm just going to call the doctor. And so I would call the doctor.
Hello.
Hello, my name's Acacia. I'm the student nurse. I'm attending Edith Jacobson. She came in for a hip fracture. She's getting ready to go into surgery, and I just had a few questions about the medications and the orders.
Of course.
So the first medication I had a question over was the enoxaparin. So the order says to give it 30 milligrams subcutaneously every 12 hours. I just wanted to say that the recommendation for that med to give post or pre-op is 40 milligrams. And did you want me to go ahead and give it 40 milligrams pre-op, or just continue with the original orders? And as well, did you want me to change the frequency to just one time?
All right, thank you so much. Definitely change her order to 40 milligrams and do it once for the 12 hours subcutaneously.
Okay, alrighty. Ideally, I would have a pen. I'm just going to go ahead and document that you wanted me to give the enoxaparin at 40 milligrams at 12, or not 12 hours, but at one-time frequency. And change it to, and just keep it subcutaneously.
Yes, ma'am.
For that med. And then the other medication that I had a question on was the morphine sulfate. The order says to give it intramuscularly, but there's the recommendation for that med is to not give it intramuscularly because it could cause a hematoma when taking it with enoxaparin. And it's also, I had a question about the reason as for the medication. So did you want me to go ahead and change it to subcutaneously for that medication?
Yes, please. Change the morphine sulfate to subcutaneously. You can give it 5 milligrams because it's in the safe dosage. And morphine is used for moderate to severe pain.
Okay. Also, did you want me to give it every 4 hours, or every 2 to 6 hours, or?
Oh, every 2 to 6 hours, please.
Okay. All right. I'm just going to go ahead and document that you wanted me to give the morphine sulfate at subcutaneously, and you wanted me to go ahead and give it every, you said 2 to 4 hours?
Yes, ma'am.
PRN for pain as needed. Correct?
Correct.
Alrighty. Well, thank you very much. Those were all the questions that I had. Appreciate your time.
Alrighty. Thank you so much.
So now that I've called the doctor, I went ahead and cleared up my questions that I had over the medication. Is when I would go ahead and take my medication. Ideally, I would go ahead and prep it, but I'm going to go ahead and direct my attention to the patient. And as I'm directing my attention to the camera is when I will pretend that I'm prepping it at the medication station. So now that I've already done my 2 checks, so I'm going to go into the patient's room. So I'll go ahead and knock on the door. Hello. Hi, my name is Acacia. I'm going to be your student nurse for today. I would have performed hand hygiene, and then I'm just going to go ahead and pull the curtain to provide for privacy, and then I'm going to go ahead and identify the patient. Ma'am, could you please go ahead and say your first name?
Hello, my name is Edith Jacobson.
And can you please say your date of birth?
April 28, 1948.
Alrighty, thank you. So now that the patient has told me their name and date of birth, I'm going to go ahead and ask them, do you have any allergies, such as, are you allergic to heparin or pork?
I have no allergies, and I love pork. I eat bacon, so I think I have no allergies.
Alrighty. So now that the patient has told me if they were allergic to anything, I would go ahead and assess their pain level. Are you in any pain right now?
My pain is at a 7 at the moment.
Okay. Well, we don't want you to be in pain, so I have some medication here for you that's going to hopefully help take away that pain.
Oh, wonderful.
So as you can see, I've raised the patient's bed, and I'm raising them just a little bit more since we are going to give them their medication. Although I would make sure to not raise it too far where it was contraindicated. So now that I've identified the patient, asked them their pain level and allergies, I'm going to go ahead and explain to them the medications that I'm going to be giving to them. So the first medication I'm going to be given is a hydrochlorothiazide. This medication is used to control your blood pressure, and it is a diuretic, so it might cause you to go at night, which is why we're giving it to you in the morning.
Oh, good.
So with this medication, I would want to make sure to monitor intake and output, weight, of course the blood pressure, electrolyte levels, muscle weakness and cramps, and also make sure to check the potassium. And so part of the teaching that I would tell the patient was, okay, Ms. Jacobson, so when taking this medication, you want to let us know if you have any adverse reactions such as dizziness, headache, weakness. You want to make sure to rise slowly and move slowly around to avoid any dizziness. Also check with the doctor before starting any over-the-counter drugs. Also, it's important to take this medicine with food to minimize pain of the abdomen. So now that I've explained to you about the medication, I'm going to go ahead and do my first check. So I'm going to go ahead and compare it to the MAR. Well, this would be my third check. So I'd go ahead and compare it to the MAR so it matches the date of birth, name, right medication, dosage. So we have 25 milligrams here, but the order says to do 12.5, so I'm going to go ahead and score the tablet in front of the patient. So I'd go ahead and cut it in half. So I'm just going to do the third check. So now that I've done the third check, I'm going to go ahead and perform hand hygiene, put on my gloves. There are no cups available right now, since everyone. Ideally, I would make sure to have a cup of water with me and a cup for the pill if the patient did so decide they wanted to have it in a cup. So I'd go ahead and ask the patient, would you like this pill in your hand or in a cup?
In a cup, please.
Okay, so ideally I would have a cup, as I said. So I'd go ahead and give them the pill in the cup. And I'd make sure, have you had any problems swallowing anything?
Nope, not today or yesterday.
The patient is NPO, but they are allowed sips with their medication. So I'd make sure to have my cup here, and I'd have the cup in the medicine, and I would go ahead and give them the cup, and then I'd give them the water, and then they would go ahead and swallow the pill. And I would make sure to ask them if they were able to swallow the pill all right, and I'd make sure to check in their mouth, maybe under their cheek or so, to see if they were able to swallow it correctly. And so now that I've given her that medication, I would go ahead and take off my gloves, because I want to change my gloves in between giving medicine. So now that I've given the hydrochlorothiazide, I would then go ahead and prepare to administer the other medications. So I'd go ahead and perform hand hygiene and then put on my gloves. But actually before that, the next medication that we're going to give is the enoxaparin. And this medication is to help you with, it's an anticoagulant, so it's a blood thinner, so it's going to help prevent pulmonary embolism and deep vein thrombosis. So I'm just going to go ahead and, so we're going to give this medication in the abdomen, about 1 inch above your belly button. So I'm going to go ahead and lay you flat. So before taking this medication, I would have, before giving this medication to the patient, I would have want to have assessed the blood platelet count, the blood pressure, the hematocrit level, look for bleeding areas, gums, bruises on arms or legs, nosebleeds, hematuria. And I would also want to tell the patient, so Ms. Jacobson, when taking this medication, you want to make sure to let us know of any signs and symptoms of spinal and epidermal hematomas, so if you notice any bruises, any numbness or tingling in the lower extremities. Watch for any, if you have any signs of bleeding, like uncontrollable nosebleeds, make sure to let us know. And also, you want to avoid the drug containing, you want to avoid taking this drug with aspirin, because that is another anticoagulant and it could have adverse reactions. You also want to let us know if you begin any herbal therapy, because that could also have an anticoagulant effect. So now that I've told you about that medication, I'm going to go ahead and begin administering it. So I'd want to make sure to tell the patient, okay, I'm going to go ahead and lift up your gown, and since I am going to give it in the abdomen, I would want to look for any lesions, any wounds, just anything, because obviously I wouldn't want to give it into the abdomen if there was any bruises. But since we're not allowed to give it in the PSIMs, I'm just going to pretend that this is my abdomen area. So now that I've done that, I'm going to go ahead and I would go ahead and compare this medication to the MAR. It matches the date of birth, name, right dosage. So I would go ahead and scan it and check for the MAR. And so I'm going to go ahead and give 0.4 mils on this. This is after I've done the calculations. So I'm going to go ahead and perform the imaging. Put my gloves on.
I went to the one in September, and the one in October, and then I joined the one here.
Then I would go ahead and clean the area.
Did I do okay though? Yeah, man, you did great. Solid 4.9.
Okay.
Not a 5. Of course not. There'll be something. You know what? I'm just gonna memorize it. I think I'm just gonna memorize it. Do you feel like it's more distracting trying to read all that stuff? I do. I think it's extra. That's what I was kind of thinking about too. Is like maybe like practicing it a couple times will be more beneficial than trying to go over and over and over.
But it's important that you get the importance of the super.
No, I mean practicing is more important than like writing everything down word for word. Because by the time you do that for every single one, that's what I mean. Dude, if you spent like an hour, like if you went and did like a couple of
Just want to make sure that my needle's in correctly. So now that I've done that, then I would go ahead and take my enoxaparin right here. Go ahead and inject out about, since I'm going to give 0.4. Make sure I have it mature. And then I would go ahead and take another alcohol swab.
Within normal, or is that?
Yeah, barely. It's
And I would go ahead and take the top of this vial, and I'd go ahead and
so
clean.
that's at the top of it.
You might. I mean, it's better than having it like cave.
Okay.
You know?
So now that I've cleaned, go ahead and
Yeah.
take off my cap. Leave this to the side just in case if I need to recap at any point. Go ahead and
I don't know, I freaked out at the moment. I was like, say a number.
check the area. I'm going to give 0.4.
I checked out these three. I have a few questions about the medications. On her medication list this morning. I did all the three assessments. Since we are injecting 0.5 mils of morphine, I'm going to draw up 0.4 mils of air. As the order themselves, I just wanted to clarify a few things. Into the vial. So I noticed that you have the route of morphine intranasal. And that is contraindication with oxygen.
And draw up 0.4.
That doesn't allow for injection.
So So I just want to get rid of any air bubbles that I see. And so now that I've went ahead and cleaned my site, I'm going to give the injection subcutaneously at 45 degrees. So I'm going to go ahead and take the site and pinch it just a bit. And I'm going to take my syringe and I'm going to put it in at 45 degrees. So 1, 2, 3. Just tell the patient to relax. And then I would go ahead and release. Let it stand about 4 to 5 seconds. And then I go ahead and take it out and automatically put it into my sharps container. And so now that that has been administered, I'd go ahead and change my gloves. And then I would want to go ahead and
These are different.
put the patient back up because I don't want them being too long in their abdomen area.
Where's the safety?
That's about good. So now that I've administered that medication, the last medication I'm going to administer, so I would go ahead and tell the patient, would be morphine sulfate. So Ms. Jacobson, this medication, morphine sulfate, is going to help for your pain. And I'm going to give about 0.5 mils, and I'm going to go ahead and do that right under the soft part underneath your arm because I don't want to do it in your abdomen since I'm just giving you an injection there. And so when taking this pain, I would have, this medicine, I would have wanted to assess the platelet count, assess the respiration. So if it was less than 12, I would have wanted to withhold the medication and call the doctor. Because this medication can cause slow respirations. And I would have also want to assess for adrenal insufficiencies, like so any nausea, dizziness, fatigue, and any signs of infection that the patient might have. And that's about it. And so I would want to tell the patient, so Ms. Jacobson, when taking this medication, if you're dizzy, lightheaded, if you have any slow breathing, just let us know, and also know that this medication can cause constipation. So it's important to let us know if you have any of those adverse effects. Also, it's important to avoid driving and doing anything that requires heavy machinery because this medication can cause fatigue. And also, it's important to walk very carefully as soon as you have this. So now that I've explained the patient, then I would go ahead and start administering the medication. So I'd want to perform hand hygiene. And then I would take my gloves.
Are you going to read the chapter? Medication?
So now that I've before even putting on my gloves, I would have made sure to have compared this morphine sulfate to the MAR. And so I'd go ahead and make sure it matches name, date of birth, hospital identification number, right dosage, and then I would go ahead and scan it. So this is my third check for this medication. And then I would have performed hand hygiene with my gloves. So now that I've done that, I'll go ahead and compare. So I'll go ahead and take my cotton swab here. And we'll just pretend that this is the soft part under the arm. I don't want to do it in the muscle whatsoever. So I'm going to go ahead and clean it and let that dry while I'm preparing my syringe.
Go ahead and clean the patient's skin off.
Just go ahead and leave it there real quick. And then take out my needle.
And do massage?
No, my neck hurts. It hurts like really bad. I slept wrong last night. And I never
Where does it hurt?
it hurts.
Okay.
Does that hurt?
Just want to make sure that my needle is in correctly. Go ahead and throw that away.
Does that hurt?
a little.
Okay.
Why?
Alright.
It's like one of those where you can't
Take
do
off
mine,
my
like,
cap.
up to the side.
And then I want to go ahead and inject out. I'm going to put in 0.5 mils. So I'm going
Is
to.
that okay? Does it hurt? Okay. What's your pain level?
Okay. I'm going to go ahead and take.
So it's like
I would have want to actually have taken an alcohol pad and I would have cleaned the top of this vial. And then I would have go ahead and
Take it before 6.
that.
Yeah.
Okay.
We're going to monitor your potassium level.
And I would go ahead and start
Um,
injecting out this medication.
This can cause dehydration or something.
Okay, so to administer this
This will make you pee at night.
pressure.
taken that medication. Then I would go ahead and, so my side is already clean, and I would go ahead and do this 45 degrees subcutaneously as well. So I'd want to go ahead and pinch my side, and then I would do it at a 45-degree angle. So I'd go ahead and insert it and tell the patient to relax. So 1, 2, 3. So I would have pinched it and then released the skin, and then injected that. And then wait a few seconds, about 4 to 5 seconds, and then taking out the syringe, and I would have immediately put it into my sharps container. And so now that I've administered that, I want to make sure that I don't massage it at all, because that could affect the way that the medication is absorbed. So I don't want that to happen. If there was any bleeding, I would have applied a cotton ball and just light pressure, or allow the patient to apply pressure. And then once that was administered, then I would go ahead and clean up my area. I would have documented that the patient received the medication, and I would have come back in 30 minutes and reassessed for pain levels. So I'm coming back after 30 minutes, and I would assess with Ms. Jacobson. Do you have any pain right now?
I'd say out of 1.
Okay. All right. So your pain level has reduced. Do you have any other symptoms?
Nope, that's it.
Okay. Alrighty. Well, I would make sure to put them to the lowest position available. So now that I went ahead and put the patient down at the lowest position, I make sure that both side rails are up, and then I would make sure to ask them, is there anything that you need?
Nope, that's it. I'm
Alright,
good.
well thank you. You've done great for me today. I'd make sure to give them the call light, and I would finish making any documentations that I need to do, and then clean up my area, perform hand hygiene, and exit the room.